right, let's develop that. So he's thinking something works where there is no what sort of basis for it working. Come now. You can't really be only 6 people in the room who understand what I say. What sort of basis? So if we give somebody something, if we give them a sugar pill and we tell them, okay, this will work, this will make you feel better, right? That is a placebo. It's a placebo treatment. The placebo effect is the fact that it does make the person feel better, even though there is no what?
Scientific or method, no reason for it to work?
No reason,
no scientific.
More pharmacological, yeah. I would say pharmacological is probably better, yeah, or physiological, or both reason that it would work. Because as we know, sugar does not produce that sort of effect. So you're giving somebody a drug, that is designed, that is tailor-made to produce a particular effect. And you give another person, a similar person, under a similar set of circumstances, a pill which is made of sugar or some other inert substance. And lo and behold, you get the same sort of effect. What does that tell you about the process then? What do you deduce from that? If that is true. If we have 2 people, we give one a drug that is specifically designed, tailor-made to do a particular job, and we give another person an inert substance that is inert, that is not designed to do anything, and you get the same effect, what does that tell you? There are several conclusions one could draw from that. What are they? Name one. The drug does not work. Right. Or well, mind over matter is a bit generalist, it's a bit generalized.
Wasn't really sick in the first place.
But what does it tell you more than that?
No. That's where the body can recuperate on
I was
its
going
own.
to get there in a minute or two, but what does it tell you before you get to that sort of level? You have a situation, a scenario where you have a drug which is specifically designed to do something, and you have an inert substance and you give that to another patient in the same set of circumstances. What does that tell you? What might be important therefore? Yes, sir.
Sir, I probably think it's the belief in the drug that it will work.
The belief in the drug.
Condition their minds to accept anything that the drug will do.
That is true. And also, is that the rain?
Yes.
Glad I have my umbrella. And what else does it say?
Sir, I think about the drug, it tells you that you need to possibly have some sort of test apart from word of mouth, because the person is getting the drug, they might think it works. So apart from psychological drugs, you probably should have another means of testing if it works.
But in the circumstance where you're administering the thing to 2 people, one of whom is getting what we consider, what you consider to be a valid drug, and what you know, as far as you know as a pharmacologist, you know to be something that is inert. What does it tell you might therefore be important in bringing about the outcome?
The persons that you choose.
Exactly. How the drug is administered, circumstances under which the drug, whatever the drug is administered. One of the things about this sort of business is that people place, certain people at least, place great faith in the medical profession. So, as a doctor, you have attached to you a certain level of